I'm here with Amy, who has recently finished some more extensive dental treatment, and she's agreed to talk to us a little bit about the work that was done. So, Amy, can you just tell us what brought you into the office to begin with?
Yes, absolutely. So I came in the office originally because I had sort of chipped off the fronts of these teeth, and also because I was having just a lot of jaw clenching issues and teeth grinding issues, and so yeah, and then we went from there.
Okay. Can you describe what we did for you and
Yes.
how the treatment went for you?
Yeah, so it was a long process. It was actually probably longer than I'd originally envisioned when we came in, but that was okay because I actually found out a lot of stuff that I didn't know through this process. So the first thing we did obviously is you were interested in finding out about why I might be grinding my teeth and fixing that before we, did any work on the actual teeth. So I went to the doctor and got a sleep study done, to make sure that was not an issue. And then what we did is we decided when you measured my bite, you realized that I'd ground down enough that it was actually a lot more compressed than it should be normally. So we decided to add 3 millimeters to my bite by adding veneers and porcelain veneers to my upper teeth all the way from the back, and then also adding the pretty veneers on the front. So for the cosmetic, and then also for, I guess, the medical, to stop me from clenching my jaws and to help with the pain that I was feeling. So that was a long process because the first thing we did is basically put on what was it called? It was
An orthotic.
an orthotic, right? And that took some getting used to, and that was an interesting process. So we put on an orthotic, and I would see how it would feel, and then we'd adjust it, and I would see how it would feel, and then we'd adjust it. And I'm really glad that we went through that process, even though it took a long time, because it was interesting to discover how your jaw adjusts to things. I hadn't really realized that was the case, and it was interesting to see how you would feel and how it might change, how your muscles felt, or any headaches that you might have, that kind of thing. So that was pretty interesting. So after maybe I think 3 or 4 months, we got to a place where it felt like this is the right jaw position, this is the right amount of tooth, and at that point, you prepared the veneers. You had them done at the lab, right? They're very pretty. Not too blindingly white, so they don't look like the fake Hollywood ones, but they look real. They have like a little bit of texture on them, which is just what I wanted. And yeah, and then we had the orthotic taken off and had those put on, and that was quite the experience. That was a good 6 hours. I don't know how you were doing it, but it was pretty impressive of having those put on, like the whole thing. And then after that was finished, there were still a few adjustments. I think maybe we did 4 or 5 adjustments after that of just fixing and making sure the bite was perfect, and now it feels really good.
Great. And you're a singer,
Yes.
and so you're in front of people all the time and
Yes.
showing your smile
Yes.
and that.
Well, yeah, I'm a voice artist, and actually I was a little worried about that because there is some adjusting to do. Like my 2 front teeth are certainly longer than they were before because the ones that were there before were a little bit chipped, right? And so at first I was a little bit, but actually it's interesting. You find you adjust to that in just a couple of weeks.
Yeah.
It fits. And yeah, so that was interesting. I was a little concerned just because I do work with my voice.
Great. So it's been a positive.
Yeah, it's been a great
experience and
experience.
outcome.
It's been a very positive experience.
Well, thanks
I
for
think so.
sharing, and we'll look forward to many years of good use out of these.
I hope so.
Veneers can last a long time, so hopefully you'll continue to be happy with them. So thanks for recording this short video with us.
No problem. Do you want